Breakfast.
Good morning, everybody. I'd like to call to order Public Health and Community Service, June 26th at 8:31. Could I get a roll call, please?
Shorten.
Here.
Sullivan.
Here.
Hanhoff.
Present.
Krager.
Here.
Hendricks. Alto.
Here.
Van Bergen.
Here. Next, could I get a motion to approve minutes for May 29th?
I'll make that motion.
I'll second.
Seconded by Mr. Sullivan. All those in favor?
Aye.
Against? Motion carries. Public comment?
We have none.
None.
Last call, anybody? Alex?
Okay, how about any member comments? Ms. Alta?
Just to let the committee members know that the applications for senior services grants actually are now out to commission members for grading purposes, for review and grading purposes, so that process is moving along just fine in 2025.
Any other member comments? Okay, seeing none, we will move on to new business. We have 4 interviews for the Board of Health. Is Cindy, I can't see, Gaffney? Good morning. If you could join us up here at the table, please.
Sure don't want the whole team of us.
Great. Good chair right there.
Thank you for joining us
Thank you.
this morning. We appreciate it. If you could just take a few minutes and tell us about yourself and your long-term service, which we completely appreciate, for the Board of Health. And then we'll leave a few minutes for questions from the committee.
Sure, great, thank you. Hi, ma'am. Good morning. I apologize for my tooth. I'm having some dental work. So it's a little crazy. I'm Cindy Gaffney. I'm a resident of McHenry County for 31 years. I live on the Kishwaukee Valley Road. I recently retired in 2023 and served on the Board of Health as the past chair in the last 3 years. I've been on the Board of Health for 12 years. I run an organization called Animal Services and Assistance Program. It's a non-for-profit organization that provides trap, neuter, return services for McHenry County. Dogs, cats, horses, live in a farm.
Give a little bit of your educational background that you bring to the board.
Sure. I graduated with a degree in psychology from the University of Utah in Salt Lake City way back in 1979. I've been a sales rep and account manager for 40 years for GE, handling a $20 million territory, senior account manager. I participated in the McHenry County Animal Advisory Committee way back when it was formed, before animal control was built. Served on numerous committees within the community. So I have a good head for business, and I do know the resources that the county has, so it gives me great pleasure to make sure that they continue.
Okay, great. Thank you. Are there any questions from the committee?
I always do. Because it's my role. You know, I know you've served, obviously, and I serve as the liaison to the Board of Health as well. So one of the constant, you're all going to get the same speech here, right?
Okay.
Should we cover?
It's the importance of showing up, right? So board meetings are on Mondays. There are also committee meetings I know that you've attended, but just for the members here for the committee, can you talk a little bit about your past attendance and the knowledge that you have about how important it is that, you know, those who show up actually are the ones who make the decisions. So talk a little bit about that responsibility and acknowledging that you do show up to the meetings and you do participate, and you were the former chair. So talk about that.
Well, I mean, I think we have every year we elect positions within the different divisions of our health department. So it's the personnel committee, finance committee, I want to say legislation, that's not it.
Ordinance?
Ordinance committee, yeah. And then we have a hearing committee. So I've traveled through all those committees, and we encourage people to take at least 3 committee roles on it. So this year, I am on the ordinance committee, the hearing committee, which has been quite interesting. And it is important to show up because we're a slim board of 12, and everyone is important to take their role seriously. My ability to interact with people, I think, serves the community well. I think I put people at ease when I'm talking to them, when the community shows up to do presentations to us, which a lot of times is heart-wrenching for some of the community people. So we embrace them. I think our board in total is got a great team of people. I mean, these two are wonderful. We couldn't do it without Melissa's input. I've gone through the process of hiring people, and so we've had to fire people within our committee, and we give Melissa support to do that. She does a great job, and it's our role to ensure that she has the tools to do what she needs to do to support the health and welfare of the community. So it's important that people show up, to your point, Pam.
And you do.
Yes, thank you.
Just saying.
Gloria.
Yes, thank you for being here, first of all, and thank you for continuing to serve. That is so important, to get good volunteers to do this work. You don't get paid for it, and you bring your expertise. I always ask the same question, just as Pam has her key question. What do you see as the most challenging issue facing the health department?
Well, I think we got through a really difficult time during COVID. You're probably all aware of the issues with the sheriffs, and then complaints on masking and everything else going on. I think we're on solid ground right now. I think we have a great staff. I think our challenge will be to embrace, and I'm older, so it's to embrace AI and the technology that brings, so that we can provide more resources to the community and understand the data that it can bring to the community to pinpoint areas where we need to put resources within the community. We have our standard programs, the WIC program, cervical cancer. The environmental department does an awesome job. So I think it's really taking advantage of technology is going to be foremost on our part.
Okay, thank you. That's a great answer, and I think I heard that from another department as well. It's really becoming the thing, you know. And I'm
not that good on it. I'm not that good
at
on it, but there's people that do that. But I think we would be behind the 8 ball if we didn't embrace it.
Okay, thank you so much.
Mr. Short.
So good question about it. That was my first question. What is the biggest health challenge in the county?
I think, well, we did a community assessment survey, and everyone says McHenry County is a great place to live. Mental health is still an issue. It's an issue with the community's perception of what resources we need to provide. It was top on the list for the assessments that we did. So I think, it's going to be a challenge with what's going to happen with funding. We have a lot of good grant funding, but as Melissa has probably kept you up to speed on, that some of those are at risk. So I think that's something that the community is looking for based on the survey and assessment that we did, and I think that's one item. I think other challenges are just to understand the demographics of the community and where to put the resources, because that's ever changing as we build up in the community. The farmland is more community-wise, so I think Woodstock's now the center of the community, but it's spreading out further. It's going to Harvard, much further than that, up north. And I think just making sure that we have the resources to reach all those areas within the community. We have the bus now, so that's great. Have you seen it?
Oh, yeah.
Yes.
We had a ribbon cut.
Yeah. So I think we're really positive. One thing I would highlight, that from a legislation standpoint, we seem to be on the forefront of the state. I mean, our legislation is in tune with what the state wants to do, but we're always on the forefront. An example, McHenry County Animal Control embraced a program after a pilot program in 2004, that now it's statewide for animal welfare. So animal control doesn't get a lot of kudos, but they're doing a really good job.
Great. Any other questions? Okay, thank you so much for coming in, and thank you again for your service. We
So can I
really
ask to have the
appreciate it.
job again?
have-
It's a good salesperson, you never leave the room without asking for
That's
the
right.
job.
That's right. I just told someone
Exactly.
that the other day.
So we will deliberate.
Okay.
Yes.
And you can stay if you'd like, but we interview obviously all the candidates and then deliberate. And we only make a recommendation. It is ultimately the chairman's appointment. So he either takes our recommendation or sometimes maybe not, but it will make a recommendation today.
Well, you've got some really great candidates here, so I appreciate it, thank you.
Okay, next up, we've got Kyle Marcussen.
Good morning. Thanks
Good
for
morning.
having me.
Thank you for being here. As you probably heard earlier, if you could just give us a few minutes background and you know, your interest in the position, and then we'll follow up with any questions from the committee.
Okay. First, I just want to say thank you to Cindy for going first. We didn't have a choice about it, but I basically cheated by listening to all the questions. So, my name is Kyle Marcussen. I am obviously a county resident. I live in Crystal Lake. I have a wife and a daughter. Been in the county for 7 years. Came from Boone County previous to that, so a little bit more rural, but some of the same feel. Professionally, I'm a career firefighter paramedic. I work a number of side jobs like most firefighters do. This is the end of my second term, so 6 years here with the Board of Health in McHenry County, and I served 1 term with Boone County prior to that. In terms of my education, I have a bachelor's in industrial technology from Purdue. I've got a lot of unimpressive certifications and qualifications and training that have no relevance to this outside of here. I will say in the fire service, one of my fortes is emergency medical services. Not everybody knows this, but about 80% of our job these days is medical. So that particular experience translates well to some of the topics that we cover in public health. Obviously not all, and one of the great loves that I've found for public health is that it's so all-encompassing. There's just so much going on. It's not all just about medicine, and there's just so much going on. In terms of, do you want me to segue right into what I bring and what I...
That would be, yes, that would be great.
I'm just trying to streamline this
Yep.
for you. I realize I'm here to talk, so I will talk. One of the things I think I bring, I'm kind of in the, I'd like to think the teenage years of my service here on this group, because I have learned serving on this board, and I'm sure it's for any deliberative body, is, you know, year one, you come in and you're like, I don't really know what's going on. Nobody really wants to talk. I just keep my mouth shut and my head down and learn how I can help. Then you get to year 2, and by the end of almost your first term, you're finally actually making an impact. And I think that's hard, because with a 3-year term, you get in there and then you're gone. You could be gone, and what did you actually accomplish? The service I provide to this board now is moving into that position where I realize that my voice is needed and leadership is needed. And I'm so fortunate to have Cindy, who served as the previous chair, Joe, who serves as the current chair, to try and follow in their footsteps and learn how this process works. I currently serve as the vice chair for the Board of Health. I'm also the chair of the Personnel Committee. I previously served as the chair of Hearing, currently on Hearing and Finance. So Cindy kind of already helped me lay the groundwork for all the things that we cover. But what I bring is that sense of where are we going, the continuity, moving up and preparing to take the reins. I'm assuming at some point to be the chair, because we all need to cycle in those positions. And if we don't have people ready to move up into that with succession planning, then we can kind of struggle. Pam knows, being on the board with us, some of the travails that we have gone through. I also bring a strong sense of service. Right? Being a sworn firefighter, that's my whole life. So when I got on the board, my schedule's rotating, but I make sure that for the next year I take every day and I will attend every meeting. It's very rare that I miss a meeting. I think in 6 years I've missed maybe 3, 2, something like that. So, because we have to show up. And that is so very important. The main meetings, the committee meetings, all of that's important. And then lastly, in terms of my service, I benefit again from our fellow board members who have additional service. Cindy with animals, Joe, a farmer, Dr. Katz with more mental health capability. I get a lot of exposure to that in fire service, but not so many of the other things, like animal welfare. It's just unknown to me. So what I bring is more of like what I see on the street. Opiates are a big concern, right? That's something I deal with daily. That literal reality on the street and the treatment to it and how we roll out those programs and what do I see that works or what doesn't work, trying to bring a sense of rooted in that world out there. So I think I bring that sense of personnel commitment, how do our staff function, and I really committed myself to coming out to our events as well to show the support for the Board of Health, which I don't think is always common. So we attended the Home of the Sparrow celebration that we just had, the Valley High event. We had our first ever all-staff meeting for the health department. These are great initiatives, and we were making really big strides. That's what I think I bring. Sorry.
That is awesome.
Oh.
I'd like to challenge all of you to find a question for that.
I don't have a question, I bring more. Talk a little bit, because I think one of your extraordinarily strong skill set is your ability to understand units of government, your parliamentary understanding, your understanding of ordinances, governance. I think that, again, is a strong skill set that you bring from your service at another government unit. So you didn't hit that, so I will for you. But it's an additional skill that many of us on the Board of Health don't have.
I appreciate that compliment. Thank you very much. I'm not always good at taking compliments, so I'll take it where I can.
He also brings donuts.
Oh.
Not lately.
I didn't today, I'm sorry. I want to say it's one of the tough realities, and I'm sure you find this as well, that in a world where as a human you can have a moral reaction to something and say, we need to do something about this. Someone's got to step in. Who can do this? You have to realize that we all play within our own little paddocks, and everybody has different responsibilities and roles. And sometimes that's a hard truth that I've had to learn in my other job, my main job, that you can't solve everybody's problems. You handle the things that you can handle, know how to refer to an outside, whoever the authority would be, and make sure that in the end, the machine, we are one part of the total machine, that we try and support that and keep it well functioning. And that if you ran out into the world saying, I'm gonna do this all, I'm gonna do all this stuff, the Board of Health is gonna do this, that's just not what we're set up for. And the case in point has become very strong recently. We have public outcry coming to our meetings, and they're saying, do something about this. And I'm confident that our incredible staff, we have done everything we can do, and we have referred to that next agency, and we need to maintain the sanctity of that relationship. That answer?
Perfect. Perfect.
Wonderful. Gloria.
Thank you, first of all, Kyle, for being here and for serving the service that you've already done. And since you opened the door, you already answered the question I would normally ask.
I cheated.
But since you opened the door to leadership, can you just talk a little bit about your leadership style and how that would contribute to the Board of Health going forward?
Sure. I think a great question, because leadership is so important. And sometimes we don't always have it in different avenues in our life, right? One of the things that I really champion is the idea of servant leadership. And that really translates to what we do in general. Yes, on the Board of Health, but remembering that who are we here to serve is that end consumer, that end client, that end customer, the public. How we do that in our individual roles is important. And so in terms of my individual leadership is not to say, I'm gonna do everything, I'm gonna push this, I'm gonna do that. Remembering that I'm here to make sure that the voices of either my immediate committee or the Board of Health as a whole are heard. I get this benefit from serving on a number of other boards outside of here, smaller ones, where we serve constituents that don't often have a voice. And that is very true in this sense that, you know, directly to your point, say I'm hosting the meeting, I'm the chair of the personnel committee. Yes, I'm gonna call the agenda, yes, I'm gonna go through that, but to make sure that each individual member that I'm there with, hey, do you guys have thoughts? Do you have questions? Do you have concerns? This isn't my show. I'm just the caretaker.
Thank you, I appreciate that.
I love that answer, that's fabulous.
Kyle, were you always a leader? Growing up? I mean, you seem to be a natural born.
Yeah.
Yes.
I never really thought of it that way.
Yeah, I mean, when you're a kid, you don't think.
Leader wouldn't.
And that's, yeah, that's true.
Let me call my, my schoolyard
Right.
friends from back in the day.
Was I the leader?
I don't know. It's a good question. I have to think about it.
Okay, well, you are one, so.
Thank you, sir. Appreciate that. Just one of
Mr.
many.
As a child leader, were you a good leader or a bad leader?
I think they're all my friends are still alive, so
Is that really the metric? Yeah.
as I'm getting older, I think that.
Questions about the biggest challenges in the Board of Health and the biggest health challenges in the county. What you can both tell us.
Biggest challenges for the Board of Health. I say this, well, this one is gonna dovetail across both of those. And I've said this, they've heard me say this at meetings. I think the number one challenge facing public health and our Board of Health, the local health department, is marketing, a lack of clear advertising, basically, to put it in one sense, out to the public about what we do. I think that we as an organization have suffered from being in the kind of silent caretaker in the shadows. Public health goes so well, so often, that we don't even think about clean water, clean food, all of the things that we do and that we never talk about. Kind of cheating again, keep talking about this, but for the fire department, right? Everybody sees a red rig screaming down the street, lights and sirens, like, there they go to save the day. Nobody really thinks about the public health employee who's driving to inspect the restaurants that you enjoy to make sure that they are still meeting those obligations. So I think we, as an organization, as a Board of Health, as the health department and public health as a whole, not doing a great job about saying, yeah, you can FOIA this stuff, but these are the things that we've done right now, this week, in your community. We put out press releases. I think, you know, they're kind of dry a lot of times, but we don't draw a lot of attention to a lot of the really good things we do. So that's, I think, one big thing goes across all of them. I think I want to see more of that. In terms of the Board of Health itself, I've touched on this before, but the cycling of these 3-year terms and then coming up for another one, we go through periods of wax and wane. When I first got on in Boone County, I just wanted to serve anywhere, and they're like, well, there's 3 openings on Board of Health, and they're open all the time. We have trouble getting physicians and dentists to serve because, again, it's a volunteer position. They've got a huge commitment. We're having to get people from outside of the county in some cases. This is a huge problem. We need that expertise. So looking at, again, succession planning, it's a struggle with our term cycles and I'm back here again, and I feel like I'm just finally making an impact. And I worry if we come off, right, say I don't get voted on, which is at your prerogative, or Cindy, or you could bring in 3 other people. The damage, in my opinion, to this organization will be hitting a reset button.
You're alluding to it. Talk about the conversations that have been held at the Board of Health with regard to a longer period of serving as opposed to 3 years.
I think we've had discussions about longer periods, 4 or 5. I leave that up to the authority that be. I'm referring to outside authority. I think that anyone who gets onto this after their first term, they start to realize that. You look at these committees and you look at serving on a public board such as yourselves, and you're gonna have people you're accountable to in the public and they're watching on the air, and you're like, I've never done this before. This might be your first foray into public service. I came with a few little experiences before this. That's intimidating. And to say, oh, I'm gonna host a meeting, and here's a Robert's Rules of Order, and I hope you can figure out how to run a meeting, that's kind of scary. So having your colleagues to look at and say, oh, wow, this is the way I want to do this. Joe Clark, our current chair, is incredible. And to watch him is just like, you talk about leadership. This guy's a natural leader. He's also in the fire service. I don't want to throw that too hard. But I'm so fortunate to be able to watch that. And I've learned from Cindy as well. Her leadership was outstanding, took us through some very serious times. So, not to run around it too much. Personally, I think they should be a little bit longer. I think it takes a while to get up to speed. Did that
It did, because these are the people that will ultimately decide that, so I wanted you to weigh in
Yeah.
while you have
Are those terms statutory?
floor. I don't believe so, no.
No.
No, I don't think so.
No, just who's on the board, the
It's
makeup.
statutory, right.
But the term length itself isn't statutory.
We can.
So we could just change
We
that.
can
Yes.
change it. Administrative services have come before, I believe,
Maybe
right?
that's something we
Well,
send
that's
over
why I
to law
wanted-
and government.
Yeah.
That's why I wanted Kyle to address that while he had the floor, is that it's been something that the Public Health Board has talked about, but hasn't necessarily moved forward. We could certainly make some recommendations and bring them to committee, so.
personally also, that if there is a concern that, oh, someone would get on this board and then they're not really showing up, they're not really, which is always a risk, it's a threat, you don't really know. So it's nice to have a track record of people who are serving, how long they've been here. If you feel that, well, I'd like to keep it at 3 because that way then we can let them go their own ways. I would encourage if we, holding minimum expectations, right? Meet so many numbers of these. We have guidelines for that, but most boards don't, right? And it's like, well, you're not showing up, I'm sorry, we're gonna need to vacate the meeting. That's obviously kind of a nuclear option, but the goal here is to make sure we're responsive to the public we serve. And it's a balance, right? It's hard when you get people in here and they're like, you realize, oh, they're pretty good at it, but it takes a while to get up to speed. Sorry, was that good?
Perfect.
And to answer your question.
Yeah.
7 minutes.
I'm working on it. No, I love that. I really need that. 'Cause
Michael, I would say that I would not necessarily as a child call that a leadership.
Yeah.
I call it more of a ringleader.
Yeah.
And you can interpret that any way you'd like.
Back to your original question, make sure I answered it completely. So succession issues, marketing, public health going forward, obviously big concerns with funding. Funding is always a huge deal. We're fortunate here that a lot of our funding is from grants. But it's, again, gonna come back to you folks for how do you handle the purse strings and what services you wanna provide. I will tell you, I wanna care for people. I just wanna do a great job, and I believe there are so many people in this county that we do a great job for, but so many more that we could do more, and it's always an issue of funding, I get that. So I see, obviously, any organization, funding is gonna be a big issue going forward. Did I answer your question?
I think the second part was biggest health challenge overall.
Disparity of access, I think, is a big deal. We do community surveys, we do outreach, but I think you're probably aware, but not everybody answers surveys. And we have a large portion of the population, in some cases, is transient, whether they're itinerant workers or even homeless. Getting those people dialed in is important. Just because they don't show up doesn't mean they're not important. And I think there's a philosophical discussion to be had, but the reality is that specifically for public health, there are health challenges that when they affect those groups, they will affect everyone. So whether or not how you feel about X population, we all live here together and we are commingling, and we need to be on top of those things from a contagious perspective. That is a place where there is an additional risk. Risk to them, threat to them that I want to care for, but also a risk to everybody else. I think we have made strides to that. The mobile clinic, this is excellent. A way to go out in the community and hit these targeted hotspots, like, way ahead of the game. That was the other portion, okay. Thank you.
Thank you for mentioning that. That's so important. We have to be thinking of everyone as part of the community, and if there's an outbreak here, it can affect all of us. So thank you so much. That is so important.
Yes, ma'am.
Are there any other questions from the members? Okay, great. Well, thank you so much for coming and for your commitment to our county. We certainly appreciate that. As member Althoff indicated earlier, we'll have deliberation shortly.
Sure.
You're more than welcome to stay, or if you need to get on with your day, we completely understand.
I set aside some time for this, so I'll need to skedaddle. Cindy's a great salesperson. I'd ask you to consider however you consider. I'm here to serve, so at your discretion.
Thank you,
Thank
Kyle.
you.
Thank you.
I know, right?
Well, you went into my interview.
I know.
I'm just gonna go.
They suck.
Yeah, there you go.
So Melissa, thank you for joining us.
Thank you for having me.
Again, if you could tell us a little bit about your background and your desire to serve on the Board of Health.
Sure. My fear is that I will monologue with no specific points for too long, so I might answer the questions individually as they were initially asked, if that's okay. So, my family name is Melissa Arteaga. My doctor name is Dr. Melissa Katz. So I got my doctorate in clinical psychology before I married my husband, and also wanted to sort of protect my professional identity and then my family identity and all of the kids that I work with. I have 2 kids. They are 11 and 7. It seems like I don't know, but they both just had age changes. And I did not grow up in Illinois. I grew up in Ohio, went to Ohio State for undergrad, the Ohio State University, where I got 2 degrees actually, one in human development and family science and the other in psychology. So I was raised by a medical doctor and a teacher, and kind of watched how the integration of how their thoughts kind of joined together to provide like love and nurturance and education, along with like clinical trials and data and evidence and research. And I was raised to believe in the medical model, but also question things, because you know, everyone has thoughts and opinions, and those are true and valid to them, but providing education that's been studied for years and allowing sort of me to make my own decisions growing up was a really important sort of family dynamic and family value. And I didn't have the stomach for a degree in medicine, and felt like psychology would be a really good sort of middle ground for that. So I have in the field, I've been in private practice, I've been in pediatric hospitals, I've been in inpatient and outpatient settings, I've been in nonprofit behavioral health centers, I ran one for quite some time, and then now I'm lucky to kind of bring all of those things together and work a lot with the community in my professional roles. So I'm part-time at a private practice seeing clients, but also full-time in a position through Alexian Brothers Behavioral Health Hospital that lets me be sort of a bridge between clinical service and our community with youth-serving agencies. So my focus for now is youth-serving agencies, but when you're working with kids, we're obviously working with the families and the schools and the communities. So I've done a lot of work in that professionally, but also I am just really involved in the community. And I have participated in and graduated from leadership of Greater McHenry County. That program was, I know that program is so amazing in helping to break down silos and really understand that, like, I don't just have to be in behavioral health. I can also use my expertise and learn so much from, like, the lead singer of a band. And we've worked together on sort of promoting messaging that's consistent. And someone who owns a flower shop or someone who's creating their own nonprofit. And it really lets you see differently. And I think that's really important to have that broad vision when you're talking about community. I also have served on the Suicide Prevention Task Force. I am a part of the Trauma-Informed McHenry County Change Team. I work with the Mental Health Board all of the time doing presentations, not just pushed out through them, but also presentations in the community for schools, for parents, for other nonprofit organizations. I am also and have also partnered with the Substance Abuse Coalition. I am on the board of NAMI. So with all of that said, I am learning that I cannot do everything. I will be transparent in that, no one can. And we talk about Kyle as like a baby leader. My parents have joked with me that growing up, like, it was my goal to be on like every club and every team. And in our high school yearbook, I like was banned from it because I was in it too much, because I was like the president of this and I did that, and my parents joked it's just because I wanted the free t-shirt, but I didn't know they were actually paying for the t-shirts. But anyway, I have always been involved. And as I'm getting older and I have this sweet and amazing family and husband and am working all of the time and involved in all of these servant leadership opportunities, I've taken a step back and I thought a lot about this board, and I did decide to reapply at the expense of much of the other community programming that I'm doing. So my goal is to wait till my board seats are over on a couple of other auxiliary boards, and I've already had these conversations because this to me is the priority and my priority. And if Kyle is in the teenage stage of his board membership, I would say maybe, am I like preschool? No, not preschool. Maybe like kindergarten. I filled an open seat about 2 years ago. So I did have that first year of like, oh my gosh, what's happening? And I'm starting to feel like I'm getting my groove a little bit more. I am a lifelong learner. I will ask questions, maybe not during the recorded board meetings, but afterwards I will reach out to learn more from the heads of the departments. I will ask questions to make sure I am understanding the nuances correctly. I have visited the departments and spent time there and learned about them and met staff. To me, those personal relationships are so important. Okay, that's me. I want to say I engage in like things for self-care. That's not true. My New Year's resolutions were to learn how to crochet, which I have not learned how to crochet yet, and also to learn how to make sourdough bread, which I haven't done. But I do run, and I do read books for fun, also for work and research, but for fun, and listen to audiobooks. Okay.
Nice.
You had your hand raised.
No, I was going to talk about, you answered the question, because we had conversations about maybe that this was the one that wasn't going to be re-upped, that this might have been the one that fell to the wayside. So you've clarified that.
Yes.
And your attendance has been remarkably good. You would have gotten the little next bar that said, you know, good attendance.
Thank you.
You would have. So I just wanted, because that's typically my question, is that I always ask people if they understand the commitment that volunteer work just assumes. Many people don't understand that you do have to show up. You can't do anything unless you're actually at the table, right?
Yes. Thank you. It went like in an order.
And then Gloria's next, And we don't practice this.
We
It's
have
just
this pattern.
It's organic,
I believe I heard you speak at the Greater McHenry County and I left there after hearing you speak feeling so energized.
Thank you.
Because you said something about finding your tribe, and it was just, I just wanted to tell you that. It was really great. So
I think I spent my whole life feeling like I don't want to say didn't fit in, but I needed to find people who believed in community and servant leadership, and like in my free time, I will create like youth serving organizations that are now actually funded by the Community Foundation. Like that's what I do when I'm bored. So thank you for saying that.
yeah, it was great, and I meant to come to you and tell you that afterwards, but you know, it was a big crowd there, and food was good, and everybody was networking afterwards and everything. So there's that. So Dr. Katz, I wanted to ask you, in your experience, your background in clinical psychology, how do you look at what can we do to address the psychological first aid that must occur after a trauma like COVID-19?
Yeah, that's a great question.
And how do you think McHenry County did at it? Because I know we did really well in a lot of areas, and just getting past the trauma and staying alive was the primary goal, but there was so much trauma that remained after.
Well, and I think too, there's primary trauma and there's secondary trauma. And primary trauma is like the one act of it actually happening in the moment, and then like the thoughts that we have after that. That secondary trauma though is like the everyday, lower level, long lasting effects of something that might happen for you. And I think that we're still seeing that now, not necessarily with COVID, but with other things that are going on for our community members. And I joined this board, or I interviewed to join this board in hopes to bridge more of an idea related to overall health and wellness. Because mental health is public health, and public health is mental health. And I know that we're so fortunate to have a mental health board in this county, and they fund great projects and great resources and great organizations, but I would love to see, and I know that there is interaction, I'd love to see more partnership if possible. And I think I've done a nice job on this board of providing the resources to the community members or the organizations who would like to participate in those educations and in those trainings. So we do have a trauma-informed McHenry County coordinator who presents and tries to bring together different speakers, and we house that often at the mental health board, but I think pushing it out more into the community would be helpful. NAMI does talks like that all of the time, but I think kind of helping people to see that I don't have to be a member of NAMI and just go to NAMI to have this talk. They are open to everyone. And I think that I'm not sure which presentation you're talking about, but I'm on the steering committee for several of the larger conferences that happen in McHenry County. And we really are trying to bring in people from all different disciplines, community members, parents, anyone who might benefit from a conversation like that, and then have it be a little bit more tailored towards the needs of whoever might need it based on that trauma or secondary trauma.
Well, I think Kyle kind of hit on it when he said we're not marketing ourselves well as a county health board. There are a lot of resources that we have and a lot of things that you do that the public might not necessarily know about.
Or be seeking out that information, right? Like, I don't know what I don't know until I need something. And then I'm gonna look for that information. And I know the dashboard has been launched and we're able to look and see sort of the statistics within the county. I think maybe bringing the education and the resources into more of like an everyday approach might also be helpful for something like that. And I think that's something that I've been trying to help with my seat on this board. Can we get into schools more? Can we get into, Girl Scouts and Boy Scouts? And can we go to other organizations that are nonprofits in the county just to share about what we do? Because I feel like I'm pretty well versed in the county. I thought I was pretty well versed in the county. And then after being on this board, I'm like, holy moly, there's so much that I don't know about resources that exist.
Thank you, thank you.
So intense.
Well, I get a friendly.
No, it's fine. So Board of Health challenges and the largest health challenges within the county.
Yeah, Let me start with largest health challenges in the county. So like I said, I was raised to believe in data and research and statistics. And I'm here because I heard the epidemiologist speak about the community health needs assessment a couple of years ago. Also, that's the hardest word to say, epidemiologist. I had to give that in a presentation a couple of days, like I practiced it like for days and days. So if anything, I crushed that part of this conversation. So I was really blown away about, from a couple of years ago, how the top health priorities, I could tie all back to behavioral health. So obviously behavioral health and substance use was one of them. And then also we had obesity, we had diabetes, and we had access to care. So I used to work in a diabetes clinic as a psychologist. I used to work in an obesity clinic as a psychologist. There are behaviors and environmental changes and lifestyles shifts that can be put into place to help mitigate diabetes and obesity. And also, access to care was the fourth. And so I'm sitting there thinking like, my goodness, like this board has really diverse representation of all of the different departments that we have in the county. Why do we not have someone at least speaking up or being able to provide information as sort of an expert on behavioral health? Because I can help with sort of more of a global response to tie in that behavioral health integration. So I see that as the top health priorities as the county because that's what they stated. I also know that the data collection has been challenging and we're not getting much information from individuals under 18. And I have worked with Melissa and the health department and the mental health board executive director and superintendents in the county to try to get more data collection happening within the schools so we can get a better pulse on it, specifically for McHenry County. Because if I go out and say, this is a problem, this is a problem, this is a problem, I want to have that data to back it. So I can't wait. It's like so dorky of me, but I'm really excited to see what members of the county are submitting in this new data collection so that we can then start working on those health priorities. I think for the board, well, I guess my answer is one and the same. I really don't love it when people don't like me. And it's something that I'm working on. It's something that I'm working on. I feel like I do my best to be who I am, and I'm proud of my background, and not everyone is gonna agree with what I say or believe what I say to be true. And I think as a psychologist and as a parent and as a human, I think we're all, whether we're board members on boards like the county board or the Board of Health or NAMI or the school board or whatever, I think that there's a lot of divisiveness and there's a lot of conflict. And I know that's part of life and I know that that's gonna happen, but my goal is to have it be respectful and be an open and active listener. People are upset for reasons. People have belief systems and values that they were maybe raised with and never questioned, and that's great for them. But I believe that when you have a seat on the Board of Health, or you are a mitigator or a listener or a person who is in a leadership role, that you are an expert in that area and you are providing the information. You're providing accurate information to the community, and your community members with their own beliefs and values can make choices that are best for them. So I think that while it might feel like a challenge, I think the Board of Health and the members of public health should provide information that is accurate and housed in science and housed in data. Just provide that information and allow members of the community to do what they think is best. Does that make sense?
Yeah, absolutely. Thank you.
I answered that.
Yes.
That's a good answer.
I want to run for political office though, because
I won't. No.
if you're a people pleaser.
I know. No, I think that's why Yes, I don't have
And I'm
plans to
not
do that.
discouraging.
I appreciate all of you. No, I am actively discouraging me. But I appreciate all of you for doing that. Maybe I'll grow with my
Sure.
confidence
Yeah.
as like a kindergartner member of this board. Maybe it just takes
Yeah,
time.
there you go. There you
I just have a comment. I don't know you, but I like you.
Thank
You
you.
send off a great vibration.
Yeah.
And that's how I roll.
Yeah, really good energy.
Thank you.
Have a-
Mr. Hendricks,
I have a question. You said it's difficult, or it's been difficult getting information or collecting data for those under 18.
Yeah.
Why is that? Is it from like difficulty working with the school? Is it because it's a new program? Is it because kids just don't want to answer?
Yeah, that's such a great question, and I wish let me think about how to answer this.
Don't you also think that's a legal issue? I don't,
Yeah,
Well, that's kind of what I was going.
Yeah,
I just, yeah.
I don't, because I am not on a board of education or a school board, and even though I do have ties to the regional office of education and superintendents, it is challenging for superintendents to have this information and then push it out to their schools. There's lots and lots of layers of people who go into making those decisions. So gosh, I wish I could just be like, hey, cool Hope Squad kids who I oversee, like, let's fill out this survey so we can get more information. But there are parental signatures and that, like, there's so much that's involved. If I had, it could be a full-time job trying to navigate that system.
Okay.
And I do think that we're starting. I really appreciate there was a joint letter written from the executive director of the mental health board and Melissa to share the importance of it. But I think part of it also might be like that misinformation, if I'm being honest. Like if you ask my kid a question about suicide, then they're more likely to try to die by suicide, which is not true. So I think education, what we're using the data for, how it helps the community, but there are a lot of roadblocks to that.
Yeah, great question. Okay, are there any other questions, members? Okay, thank you so much, Dr. Katz,
Thank
for
you.
coming in and your ability to serve. And as Member Althoff indicated, we will have deliberation shortly. You're more than welcome to stay and listen. We have one more interview, but then ultimately it is up to Chairman Bueller to listen to our recommendation or go another way.
Great, thank you. I did have a meeting that started at 9, so I probably will stay for a little bit, but then sneak out for that. Thank you.
Thank you so much for coming in again. Yes. Okay, Carolyn Lawson. Good morning. Thank you for joining us and your interest in the Board of Health position. If you could take a few minutes and tell us a little bit about yourself and your interest in the Board of Health.
And take a deep breath and relax. And bring in my behavioral health experience. There you go.
Yes.
I began I grew up in McHenry my whole life. Moved here when I was 5 months old, so I grew up in the public schools, McHenry. My husband his great-grandfather is a founding father of McHenry, so he's inbred in the community. So we're very well involved in the community. We've done a lot of volunteer through the years. I started my nursing career in 1977, which means I got the privilege of going through the AIDS scare and how people didn't believe and how the prejudices against the gay community with AIDS and how people were afraid to even go care for a person with AIDS. And I realized really quickly that nursing in my life would be centered around people and how to help them. do the best that they can. I am retired now, and I do keep my license current because you never know what's gonna happen, where they're gonna need somebody to come in and volunteer. Like for the pandemic, I offered to come in and help in any way possible. So what I was saying with AIDS is I've lived through, working through AIDS, Ebola, H1N1, SARS. I worked in our county jail as a nurse during the SARS crisis, and also with the immigrants that were gathered and receiving due process for being in our country, and then figuring out where to place them. We cared for them with the most respect, and especially the little Chinese women, Asian women that were there, checking on their diets, what they could tolerate in their system to best eat, and how to help them feel the most comfortable in a scary situation. So, people. I've also had the experience, I have 2 birth children and 1 adopted child, and my husband, who is also volunteers a lot, but decided in my nursing career that I could be a foster parent for special needs medical children. So we got a child that was also a different race than us, which was a big challenge, raising a child of a different race in this community. So I learned a lot that way. We also found out that our foster child was profoundly deaf. Didn't tell us that piece when we brought her home to our house. And I was, through being an advocate, which I'm a very strong advocate for people, we were the first in the state of Illinois to get her the cochlear implant through Medicaid. First ones. After her, 4 more children were implanted with the cochlear implant to give them hearing and therapy following. So I am a strong advocate. I think with my experience with working in Elgin Mental Health Center, McHenry County Jail, I was school nurse, and that helped me with recognizing the issues with the deaf, because I do the screenings for hearing and vision. Also worked behavior health for quite a while as the nights. So that was always exciting. And I remember the one time I had been working at the jail, and then I was working nights in behavioral health unit. And the one patient came out of his room and says, "Oh my God, are you here to take me back?" So I said, "No, we're just here for the night. You're here for care. We're going to give you the care that you need." So you go, "Okay, fine." So I said school nursing, camp nursing. I was a camp nurse for cerebral palsy, Duchenne's muscular dystrophy, and spina bifida. Taught me a lot. And going back to being a foster parent, I worked in the public health department during the period when they decided, we have to give a booster for the MMRs because the kids were starting to get measles, mumps, and rubella. It wasn't lasting, so they had to get boosted. So they needed nurses to do this. So I went under contract with the state of Illinois, which is why you won't find me on the records for working for the health department, doing all those clinics, and then also working in the well baby clinics, doing all the immunizations and teaching with nutrition. And this helped me when I became the foster parent, but then being the foster parent gave me the opportunity to be on the other end of the spectrum. I would get to go to a 9 o'clock doctor appointment and not get in until 2 o'clock because we were now Medicaid sitting in a university hospital waiting room. And, you can't get that care because it's not covered by Medicaid. You can't get this care. I experienced the WIC program as a parent then because I was required to do the WIC program, being a foster parent, and take my little, papers to the grocer to get her the food and sometimes get the looking down the nose stare. Because attitudes were different when I was on the side of being the nurse in the community working in the public health department, and then when I was the foster parent and handing out my things. So I could see that, and I know that people are people. And when you say with marketing with our public health, I totally agree with what he was saying, that a lot of times we think the public health is just for if you're really in a dire situation that you have no money and you're, needing care. It's for the wealthier part of the population too. The wealthier part of the population, I think we have to get rid of that stigma of it's just for the WIC program. I think people just look at it like that. There's so much more. There's, the water safety, the food safety. We have to, like the restaurants, when the health department comes in. Oh, I didn't mention, I'm sorry, the last 20 years of my career as a nurse, I was risk management, risk and patient safety, and infection prevention, which was just delightful during all the H1N1s and the COVID. And people seem to fear the health department when they're coming into your restaurant because, oh no, they're gonna close us down. Well, we have to keep E. coli and salmonella out of the food that people are eating. And people should be working towards that instead of fearing the health department, working with us on what can they do to keep their restaurants going. Because we've had some restaurants in the recent years that have been closed down because of, outbreaks. And it's because somebody probably doesn't wash their hands after going to the bathroom and then touches the food. So don't fear, I think, don't fear the health department that they're coming in. Because I know when we go to a lot of community things, oh, the health department says the people can't pick up their food. We have to serve it to them. Okay, we're gonna keep the germs down. We have to do that education on that. We're doing a good thing. We're not making your life harder. We're helping to keep our community healthy. And I think that's the #1 goal of the health department, is to have a healthy community. And especially with the fundings, oh God, the funding changes that we will be facing. How do we make this work where we can still give the good care, give the education out, be in our community, and see what people are stressed about, and help them to maintain their health. I know the elderly group, I'm grateful, we don't think about hydration. We think about hydration when we're going to the gym and we bring or we're going to a meeting, but we have to have an awareness that as you age, you lose your drive for thirst. So this is why the elderly tend to dehydrate. And the other piece is they don't want to go to the bathroom 100 times during the night. So how do we work that around so they're hydrating? Because if you put it together with funding issues, okay, maybe we're not going to have all the health care that you're used to having. How are we as a health department going to keep you as healthy as possible through these times of cuts? Hydration. Let's put on keeping these elderly hydrated, keeping them a little bit, more active. It's just all those things. The pieces all fit together. Yes, ma'am.
Great, thank you. Two things. One, talk about your availability to serve and the time commitment, and then also provide the board with a little bit more information about your passion and what brought you to apply for the board.
I have a lot of availability. I am retired. I am used to being out in the community. I am used to volunteering for for things. I think COVID put a stop to a lot of that, and then we had a big health scare in our family with the member, and so that took my time, which I learned a lot from that, which will be supportive of public health. And, but the time commitment, no problem. I am available, and I'm good at staying awake into late meetings.
Have you watched any or listened to any of the Board of Health meetings?
I've been to a couple of meetings, and that was really interesting because I got to see how the community presents. There's an ongoing issue where I get to see that and how the pieces, go together, and how everybody is working towards a solution for that problem. We've got the different boards are all involved with that, So that was good. I didn't get the privilege of sitting in a private session, it's just in the community session. But I will say that my husband spent his working life too volunteering. So he was on city council and 2 different school boards. So by osmosis, and I'm surprised he didn't say, "What are you thinking?" But he encouraged. He says, "Do it," because he says you'd be good at it. You have bring a lot of experience, and in different areas. And then what brought me to this? I love people. I love people, and I love our community. And I think you can tell that because everything I've worked in has been community. Plus, I was a Sunday school teacher forever, and I choreographed all the musicals in the high school when they needed somebody to do that, and I directed the cheer team thing when they needed that one, and I taught dance in our community for many years. So I'm used to maybe I'm not sounding that professional here because it's nerve-wracking, but, but I'm used to being in front of people, and I'm used to being out in the community and being around kids, adults, elderly. I worked in a nursing home for a while. I still, in 1978 through 1980, I worked in a nursing home, and I still remember some of my patients. Can't give you their names, but I can still remember, and their little things that they liked and their health issues. So, and I also worked for a pharmaceutical company that serviced all the nursing homes in Northern Illinois. So my title was a nurse auditor in that job, and it was preparing them for a state inspection from public health departments. So with that, and really explaining how when the medicine is expired, you cannot use it, get rid of it. Yeah, so that was that. So that was that experience. And then in risk and patient safety, I have been through every part of our entire health system in McHenry County. I have been in the basements, the hospitals. I was part of when we were building Huntley Hospital. Also, I advocated a lot for our behavior health because, as you remember, our behavior health outpatient program was in the back of the old South Street Hospital. Okay, so I was very upset all the time because as they enter, there's these railings that were falling off, and it's the back entrance, it's the old ambulance entrance, and these are people who are trying to pull their life together. They've been through a lot, and they're just trying to step forward in their life, and they were walking into an area that just wasn't. Because if you look at the Cancer Care Center, that entrance is beautiful. You look at all that. So guess where we are now? We're in Doty Road in the beautiful hospital there, and have a beautiful unit that I was able to help, get that going. And also the behavioral health, our emergency rooms, how they have the behavioral health. I was on those committees and very instrumental in getting our behavioral health emergency room program set up, and also a little dabble into autism patients because we're having a lot of problems with autism patients and understanding how their brain is functioning compared to how our brain we gotta get this done now because another one's coming through the door. So a lot of that.
Ooh, thank you.
That's it. So I don't know, there's probably more, what else you want?
Any further questions?
Oh my God.
I'll end with my two,
Okay.
biggest challenge on the Board of Health and biggest health challenge in the county.
Yeah, well, I think the biggest challenge is gonna be funding cuts. I think that's gonna be it, and we can't focus on, I know money makes the world go round, but it's, the part two of yours would be getting the trust in the public. I think there's a lot of distrust now. I've been battling for, several years now. Yes, you need to get your COVID. You gotta protect yourself against COVID, and shingles would be a good idea too, and all that. But now there's this big fear about getting immunizations. And I think that's gonna be a big, big challenge. Dr. Huffy's was my medical director, very nice person. He was always talking about, the herd immunity. We really have to consider that, because when we get the immunization, yes, it's gonna protect us, but it's gonna protect our neighbor across the street going through cancer treatment. And that's what we have to get over, that fear, and we have to bring together. Oh, and you were asking about how the community how they're coming out of COVID. This isn't public health per se, but do you notice how the communities are coming out and doing a lot of things together? McHenry just painted a mural Saturday in 100-degree heat. I was very worried for them, public health and nurse-wise, but they did okay. Nobody collapsed as far as I know. But things like that are bringing together. And then Woodstock had their Pride Parade, which was fabulous. I didn't get to go because we were doing our Father's Day that day, but my nieces and nephews went. And said it was fabulous. So people are coming out of the woodwork, and I think communities are growing, like McHenry's doing their river walk, and that's all community-based, people together. And I think when you get that going, then you can say, yeah, how you doing? I'm gonna go get my COVID shot on Saturday. You thinking about that? As you're standing at the McHenry Point listening to the music, you just kind of bring it in. I think we have to alleviate the fear. You are not going to have people crawling up through your arms seeing what you're doing because you got a shot, somebody did say that. So I think that's it. I think we're, as a public health department, if I were on the board, I would be out in the public. Not just gonna see me doing public health, at the meeting on Monday nights. It's constant. And like I said, alleviating the fear. I have a friend who is afraid of getting the immunizations. And, we're working on it. I don't force anybody to do anything because that would be the wrong thing. But you want to give them the information. And if the public health department can give that information out, and then we as a community and part of the board, it's our responsibility to promote that. And go to meetings. And be at all the meetings.
Do we have any other questions?
No, but thank you for the hydration reminder.
Yes. I looked around for my coffee mug when you said that, but I think I left it in the car.
Gosh, and then my urologist friend who says, okay, you gotta get out 2 liters a day. How you gonna get out 2 liters? You have to take in 2 liters. I'm like, okay, fine, we'll do it.
Well, thank you so much for coming in and your interest in the position. You definitely have a very expanded background, and we appreciate that. That's what we need, because the health department is pretty wide encompassing. So thank you again for coming in.
And I enjoyed the people on the board when I was at the meetings. Nice personalities.
Great. So next we have deliberations.
So if you don't mind, let me talk a little bit as the liaison.
Yes, I would appreciate that.
Sure.
Thank you.
I want you to know, I personally encouraged Ms. Lawson to apply. There was some discussion by Dr. Katz about potentially not reapplying because, as you heard, she is phenomenal. As a board member on LGMC, I'm very proud of her. She's very involved in a lot of community things. So I personally encourage Ms. Lawson because I think she's got a remarkable background, again, in a wide variety of areas and brings all of that to the Public Health Board. And I think we're doing a remarkable job. I certainly hope you all take away the work that's being done and the level of professionalism that is reflected by these individuals on this board. I can't speak highly enough of them. I really can't. And we deal with the huge issues. And the issue they're all referencing to is the people who came to our board and talked about the dogs in Belvedere. Okay. So there's a lot going on, and I really think everybody does a great job. But I'm going to leave it there because I think every single person you have in front of you is highly qualified, would do a phenomenal job. I love the idea of having new people with new perspectives join boards. I also recognize everything that Kyle, who I hope ultimately comes back and is the chair moving forward after Mr. Clark's time. However, we grapple with this. You want continuity, you want historical perspective, you want that, but you also want to open up opportunities to new people from the public who have maybe a little bit, as I look at people who are new on the board, who have a little bit maybe of a different perspective and bring that and shift sometimes the dynamics on a board. So I'm gonna sit back because I love them all.
So can I ask a question for clarification? How many open?
Three.
We
have three. There are three.
Three, okay. And how many, what are the years? Because weren't the terms
I
like?
think they're all 3 years.
They're all three?
Yes, thank you, they're all
So 3 positions, all 3 years? And how many nurses do we currently have?
3.
We have 3
The
already.
magic number is 3.
Okay, so we already have 3.
We have 3.
Okay.
We are required to have 1 by statute.
Okay, and we have 3. Okay, just for clarification.
And these are all just general positions, these aren't like, none of these
The
positions.
current ones are general positions. We still have a quasi-open physician,
Who is certain, right?
physician who is also very busy, but she has committed to staying until we find a replacement. So I believe that is posted, but these current positions are all 3 general.
Does Dr. Katz qualify for that physician position?
Yeah.
No,
It's a medical.
Yeah,
Okay.
she's a
Licensed
medical psychologist.
And can you run through the entire makeup of the board on what it's supposed to be as far as?
There's
2,
Go ahead.
2 physicians, a dentist, nurse, liaison. Yep. I feel like I'm missing one.
I think that's it.
Physicians, nurse, dentist.
Dentist
Liaison.
and the liaison, and then everything else
at
is
large.
open. Yeah.
I would like to make a motion that we go with the first 3 candidates.
So Cindy Gaffney, Kyle Marcussen, Melissa Katz.
I'll second.
Okay, Mr. Shorten seconds. Discussion?
I'd just like to say that the continuity is so important. And all of these are very fine candidates. But I think, exceptional candidates, actually. But I do think that the continuity is very important, especially at a time like this.
Mr. Shorten?
I mean, we have challenges when it comes to appointments. It's either one or two extremes. One, we don't have enough, or B, we have too many.
Too
and
many.
Too many usually are all well qualified. So this is a difficult one because you have 4 good candidates and 3 seats, and you wish you could add 1 more. You just do that at the drop of a hat. So I would encourage Carolyn to, the next opening that comes out, that's either nurse, is it a registered nurse, I'm assuming?
Yes.
Doesn't matter whether it's active or,
I don't believe so, no.
No, they have to have.
Is it an
a
active?
license, Yes.
And she says she has her license, so.
or one of the other broader positions.
Is there any other discussion anybody would like to bring up? No? Okay, then we will move forward with the roll call, please.
Hendricks,
Yes.
Shorten,
Yes.
Prager. Yes. Sullivan,
Yes.
Van Hoff,
Yes.
Altoff,
Yes.
Von Bergen.
Yes.
And I too would just like to say, Carolyn, stay engaged. I think she's an excellent candidate, but I concur. I think continuity is remarkable, and we've gotten, after a while, we finally, I think, have a halfway decent balance on the board of people who represent, animals, environmental science, the medical field. I mean, public health is a vast area of expertise, and I think that right now, what you have on the board is extremely interested and qualified candidates. And again, I think it would be wonderful if Carolyn remained engaged and continued to attend some of the meetings, which she's done, obviously.
I agree. One position I would like to see moving forward is an environmental health background. I think that's.
It's where we always are short.
Yeah.
Yeah.
Okay. Well, thank you, everyone. Yes, okay, moving on to the routine consent agenda. Are there any items anybody would like removed?
Then I'll make a motion to approve the routine consent agenda as presented.
Before you do that,
Oh,
I
oops.
would
you're gonna pull one
like, let's see, it is 6:03. Do we want to lump 6:2 in there? There's only, I'm thinking just 6:3, which is the CDBG allocation.
Oh, ready to have that discussion now?
Well,
Sure.
Well, we definitely are now.
So
Now I'm curious.
I'll amend my motion to approve the routine consent agenda minus 6.3.
I'll second that.
okay, Mr. Hendricks, seconds, and a roll call, please.
I didn't realize it was today.
Shorten,
Yes.
Sullivan,
Yes.
Hendricks.
Yes.
Prager,
Yes.
Van Hoff,
Yes.
Altoff,
Yes.
Von Bergen.
Yes, thank you. Okay, so 6:3. Can I get a motion?
Oh,
to
I'll
discuss?
make a motion to approve 6.3. Sorry.
And a second, Mr. Shorten.
Our discussion yesterday was prospective.
So the discussion, I guess, comes back to, this is allocation for the Community Development Block Grant Program.
And I'm getting, these guys are, Brandon's helping me square on the timing. We had a conversation yesterday with our representative at CDBG, or at HUD, and his boss, and basically telling us, looking ahead, for these dollars, we've got to recognize that the dollars are getting tighter and tighter and tighter. Our staff is really stressed and we don't have much staff for the amount of dollars we're allocating. We need to hit fewer projects and hit them harder. So we'll focus a little bit more on infrastructure, less on services, and like I said, it's better to do a few things big than a lot of things little.
It goes back to the Pam Altoff theory. Don't give everybody a dime, give somebody $1, right? You can't do anything well if you short everybody,
That's right.
So it's government. That's not, I mean, that's how government works.
So now, help us on the timing, because this is for, that discussion is more for the next round.
Correct, yeah.
And that's what I wasn't clear with you on this morning.
Okay,
So,
okay.
And so our
that's-
timing is kind of a little different than HUD's timing with some of the planning. And so this is the 5-year plan going in, which is also on resolution for today too. Not full, but CDBG was. So these are the reduced amounts based on this year's allocation. So I went through all the projects. We anticipated receiving about 1.3, or 1.4, I'm sorry. We received 1.3, so I made reductions for all the projects equally across the board. Same with the home grant as well. We anticipated receiving 600,000. We received 537,000, so I made similar reductions on those projects too that were recommended. So this is where they landed. And so based on our consolidated 5-year plan, kind of the timing with HUD is that we always do the first year. It's kind of a little bit odd that we allocate the first years of projects and then we put them into the 5-year plan when really year 1 has already been kind of sold for. So moving forward, exactly as Pete said, we met with HUD and their guidance was to really make a big splash into certain projects, whether we really focus on infrastructure 1 year and really fully fund those infrastructure projects, and then maybe we look at housing or public services the next year and so on. And so really that's kind of the direction that we're looking to go. We have some internal ideas on how that might look, and we're looking to have meetings, of course, with you and Larry to kind of talk over what the commission would like to see to make recommendations on. But I think that the plan is very strong this year, the 5-year plan that is the consolidated plan. And then these projects are gonna make a big splash for what our goals and outcomes that we projected for the next 5 years as well.
Yes, myself.
She looked at me, I thought I was just saying, don't say that. Two questions. One, did you get a feel that the grants will remain, that grant amount will remain steady over the next 4 years? Or did you get an implication that it's gonna decrease every year thereafter? And then number 2, what's our idea of notifying all of our applicants about any shift in the way we're doing this?
Absolutely. So first, your question, the allocation, we're anticipating to receive something similar next year.
Okay.
The next 3 years are a little unknown right now, depending on it. We've seen different things slated from the administration of completely removing home and CDBG. Same with the homeless programs as well. So right now, from our kind of internal agencies that work very well with Congress and are a little bit way more in tune, they're receiving guidance right now that it will be similar allocations next year. And then for your second comment too, we will always have the allocation plans out next year for the annual action plan. And so those are, you have your 5-year consolidated plan, and then each year you have an annual action plan feeding into that 5-year plan, saying these are the goals that we want to focus on this year, and this is how it'll translate to the goals that we anticipated for the 5-year plan. And those will be distinctive discussions with service providers on what they would like to see coming out of that year plan. And we've met with many municipalities and townships throughout the consolidated plan, forming that, saying what projects do you guys have in the hopper that you are anticipating that we will see or that will be needing funding in maybe year 3 of our plan or year 4. So we're hopefully trying to align the funding that makes sense with what we've heard.
And that's exactly where I'm going, is in the event that we do receive information about what's going to ultimately be removed from the program, maybe that elevates whatever that last year is, that we address those needs, saying this, adios muchachos, but we're giving you this, right? I mean,
Correct.
So I just want everybody to be aware that we kind of prioritize that as we move forward.
And I would like to make just one change. I noted it to Kathy too. There is, on the consolidated plan, it says that we had a public hearing on June 24th. We actually moved that back to July 15th at 10 a.m. So it'll still be happening, of course. It's out for public comment right now, and then the public hearing date will be that July 15th date.
So about the funding for this particular one, since I found out that, we are getting less than what we had anticipated at our allocation meeting, I I guess going forward, I guess I would like to see us during that allocation meeting continue on with, maybe what the prior year actually was, because I believe we've been working under the assumption of 1.4 million for the last many years, because we haven't seen any increases. And typically it has been cut back the last few years, from what I recall. So I'm kind of beating myself up a little bit, because I feel like during that application or the allocation meeting, we should have recognized that that we did get those cuts the last few years, and the allocations that we made were under the assumption that we would get the full amount. And I feel like if we were under the understanding that we weren't, I feel like the allocation process may have been a little bit different, because there were a few projects that are receiving funding during this round that it was pretty evident if they, were not going to get a certain amount, the project just may not happen. And in the past, we were able to have another meeting and, reallocate, but I don't like that process, I guess, is what I'm getting at. And can we be sure to, moving forward, recognize that?
Maybe you elevate that in a point thing or whatever. You elevate that criteria when you consider. I just wanted to ask too, like in senior services, we actually are taking much of our invested interest money and kind of setting it aside for, unanticipated. Are you guys doing something similar, or is it impossible to do that because of the way the program works? I was hopeful, but softball question, you can always tell people.
We tried.
We tried, yeah,
Yeah.
right, exactly, we tried,
That would be nice, yeah.
Thank you.
Pete had mentioned that the priority was to go, for the higher impact, and that maybe organizations that weren't asking for as much because it costs equal amount of money to, as far as our resources to, fund a smaller, lower impacting project versus a bigger project. The cost for us is the same for administration.
100%.
And that's what we're
The
looking to
amount of work
even reach out.
involved and
Right.
administrative costs is the same whether it's 25,000 or 250,000.
And like some of them, you'll see at kind of the lower end of the resolution with the dollar amounts. And those are the agencies that I would like to have conversations with in a bigger span and say, instead of putting forth an application for 15,000 or 20,000, when really it's about 25, 30,000 on staff costs to oversee that grant, put forth an application of 80,000, go big. And then we can really fund that program 1 year, maybe take a year or two off and then come back and ask for another, and that's
so counterintuitive.
Totally.
Seriously,
Yeah.
as to how
It
we've
is.
taught those organizations in the past. So those, again, thank you. Those meetings will be absolutely crucial.
Yeah, it'll be a lot of conversation.
Yeah, yeah.
Any other discussion?
I'm
No.
sorry.
I have a question.
I appreciate your input.
Services and agencies have sustainability models, and if the event that they did not receive these monies, would they be able to sustain?
Yes, most of these programs are all not like one-offs or anything. They're usually salary tied or anything like that. And they've come back with slightly different budgets. Sometimes it'll be funding like a case manager's salary, then next year it might be a director's salary, for instance. So I know that there's some shifting in budgets to allow, but none of these would cease to exist.
Okay.
Okay, with that, could I get a roll call, please?
Krieger.
Yes.
Hendricks.
Yes.
Manhoff.
Yes.
Sullivan.
Yes.
Shorten.
Yes.
Alto.
Yes.
Hamburgen.
Yes. Okay. Seeing no old business, next up we have a presentation. Thank you.
Thank you.
For the Birth to 5 Illinois.
Kobach reached out to me mid-May, thereabouts, kind of wanting an opportunity to introduce Birth to 5 to the county board. We had talked about presenting in May, but you had environmental health doing a presentation. We didn't want to double up, and you were was patient enough to wait for today. You mentioned you did a public comment to the county board in June.
I did.
But I think if you could give the group a little bit about what you and your team do and kind of how you fit with the larger state project.
Yeah. Do you want me to sit?
Yes. You're more comfortable.
Everyone can come up. Yes.
Yes.
We'll ask questions. Everyone should, yeah.
You might see some picture taking too, because we document what we do. So we are Birth to 5 Illinois. We cover Region 44, as you can see, which is McHenry County. I'm Nicole Bach, the Regional Council Manager, and then I have Christine Cozy, who is the Family and Community Engagement Specialist, and Michelle Pineda, who is the Administrative Assistant. So on the next slide here. So what is Birth to 5 Illinois? So we are an organization. We work in every community in Illinois. There are 39 regional offices, and we were developed to find out why families are not able to access the early childhood education and care services that they need. And then we tell the decision makers in Springfield about our findings and what these children need to thrive. So essentially, we're the platform for local families, early childhood providers, and community members to share what's best for the children's future in our community of McHenry County, and then bridge that gap between the families and the decision makers. You can see up there, we are a department of INCRA, which stands for the Illinois Network of Child Care Resource and Referral Agencies. In all of our regions, we have action and family councils. We do operate independently of the Regional Office of Education, but we follow their boundaries. And we do have efforts to aim to match policymaking and funding distribution at the state level with the local needs. So I actually do keep the senators and the representatives that cover our county updated on what we're hearing. And then dedicated staff in each region. So each region does have 3 staff, and then we do have what we call a state team that oversees all of us. And then in this graphic, you can see it depicts our planning model to support inclusive participation and communication. So we have Birth to 5 Illinois in the middle, and then our councils. Our Action Council is comprised of people who are just interested in making sure that the children have what they need. They're leaders in the community. So right now, for example, we do have someone from WIC, we have NAMI, Early Intervention, the Home Visiting Program, Child Care Resource and Referral Agency, and we also keep 2 spots open on the Action Council for Family Voice. And then we have a family council, which is comprised of those families that live in McHenry County that have the littles. And going around that circle, we have, like I said, we have the community leaders. We want those advocates, the providers, teachers and staff, the elected officials, and parent, caregiver, and families. And we don't have any official local collaborations, but in McHenry County, but those are the voices that we always are striving to hear from. So we have been doing work for 3 years now. We're ending year 3. And our first year, we did write an early childhood regional needs assessment. We found this information. We were given data from the state. We were given data from our county specifically. We held focus groups, one-on-one interviews. We had online surveys, attending events and talking to families, and then, of course, our Family and Action Council. But every single region in Illinois wrote an early childhood regional needs assessment that talked about needs and recommendations for their community. What we found is, you can see up there, the biggest one I want to bring to your attention And it's actually higher now because when we started writing this in 2022, the data we had, was from 2020, so it is higher. We currently have, according to the Illinois Child Care Asset Map, 14,590 children in McHenry County who do not have a slot in a licensed or license exempt child care center or home. So that's a lot of kids who don't have access to child care. And then what we heard,
Can I?
oh, sure, go ahead.
How do we determine that?
How did we determine how do they get the data? They look at how many childcare programs each community has and how many slots they have available, and then how many children are that age before kindergarten.
So,
Yeah.
oh, sorry.
No, go ahead, no.
So Mike, is that, so like, my wife and I guess fairly recently had our first child, and he stays either at home or with grandma or
Yeah.
Different grandma. So my question is, would he be wrapped up
He
in
would.
that number, even though we're not actively
Yes,
looking?
so not all families choose childcare.
So that's just the raw number?
That's the raw number.
Okay.
It's just more of keeping in mind how many children are without if every single person needed.
Understood.
Is there a percentage, is there another point to that, data point to that? Is there a known percentage of families that are more like Eric's family that do not choose to look for?
We do not,
Okay.
we do not have that
Okay.
kind of data.
So, and that number those are the children that lack license care, is that correct?
Or a license exempt center.
Okay.
Yeah.
Okay, same thing.
Yeah, well, license exempt
Well, I
isn't
mean-
DCFS qualified, yeah.
It's not being done by a family member.
Correct, yes, yeah, yep. Remember I said that we did talk to a lot of different people and held surveys and focus groups and everything. So these are some quotes that we heard when we were talking is, we need legislators to make early childhood education and care a priority. We can't open the economy until we open slots in daycare centers. People can't work because they have to take care of their kids. We also heard, this is from this was actually a family child care provider who was licensed. If my significant other was not the breadwinner, I would not be able to do the job I love. It is hard to find a child care spot, so when you do, you grab it and keep it even if you're not happy. The early childhood programs are not conducive for those children that who need that extra service, since there are no training for these teachers and there's no requirement for a lower ratio as the public schools have. So,
I have
yeah.
Excuse me, I have one more question.
Sure, go ahead.
What about employers that have childcare on premises? Those are normally licensed operations that are going on inside like a big corporation or something.
Right, we have none in McHenry County.
We don't have
No.
any at all?
No, and right now we are actually doing a little bit of research just to see if any child cares have an unofficial, maybe a contract with a business saying maybe they help pay for their employees to take their child to a certain child care. So we're actually looking into that right now.
Okay, what about in McHenry County College? There is some childcare that goes on out there.
Yes, correct.
So how would that figure into that number?
That is a licensed program.
It is a licensed program.
Yeah, but it's not just for the employees, it's also for students.
Okay.
Are you asking?
I guess
about-
my
yeah.
question is, does that go into that number of children who do have licensed care?
Oh, yes.
Because it should.
Yes,
Okay.
absolutely.
So I just thought about one like that at McHenry County College. Is it the only, facility like that has,
Oh, a child care inside of it?
Yes, a child care center where mom or dad can work and your child is there. Is that the only one that you know of?
That is the only one in McHenry. I mean, we do have the one that's on base there at Northwestern in McHenry. Again, that's not just open for the employees. And right now we are trying to figure out again if they if their employees get any kind of discount where the employer helps pay for it. So like I said, we're looking into that right now.
Okay, so that seems like, I don't know how many, what the number of big manufacturers or corporate enterprises are in the county, but it seems like that would be a good place to look at, because I know in some of the other counties, that's what they're doing.
Oh, absolutely, yes. And actually, several years ago, Follett looked into it. So they contacted the Child Care Resource and Referral Agency and said this was something they wanted to look into for their employees and have a child care on base. The problem is when they started hearing the logistics of what you need to run a child care and that there's not enough teachers for even the child cares we have open, they decided to, at least, I don't know if they said forget it or just hold off.
Okay, thank you.
Yeah.
I was gonna say, I think most businesses, when they hear from their employees enough that that's an issue, seek to try and fulfill that demand, but run into exactly that. And a lot of it is that there are not enough qualified individuals to actually hold those positions for those.
Correct.
Yeah, I mean, I hear that all the time too.
Yep. And on a side note that it has nothing to do, well, I mean, it has something to do with this, but it's not on here. We are now putting together plans. We're gonna host a community meeting August 26th in the evening virtually. We're hoping to get business leaders to attend. Obviously, we'll be marketing it as much as we can to let them know that this childcare crisis is an economy business crisis. Because we need more people to be invested and advocate whether they have those young children or not.
Are you looking to our administration and making sure that we contact McHenry County Economic Development Corporation? Because that would be the that would be yeah.
Yep. So based off of what we heard, we made some with our councils. We had recommendations, and then we started working on putting an action plan together. So we took some 3 big recommendations and started working on them, putting SMART goals together to figure out how we can help the community right now. Even before funding comes in from decision makers, what can we do? So the recommendations we've been working on is to provide that ongoing education on the importance of early childhood education and care programs. A lot of the teachers were saying, and even the directors, a director put it perfectly when she said, people might not start when they hear the pay. They might interview and then decide it's not for them because of the pay. But the teachers who do start and are a part of the programs leave because they're not respected. It's not, even though we're taking care of these little humans during the most important years of their life, they're not respected as much as like a public school teacher. They're asked, when are you going to get a real job? They're not paid adequately. So we are trying to provide ongoing education on the importance of what they do and what these programs hold. Create an information hub on the integrated referral and intake system, IRIS, to connect families to their specific early childhood education and care needs in the region. So I have been advocating for this for probably 2 years now. The Mental Health Board has said that they have put it in their budget for their next fiscal year, which starts in December. So when a new executive director, unless you guys know one started, I haven't heard, okay. I absolutely will connect again with them and say, we can help promote this. I have a relationship with Kane County's IRIS team, and they are willing to come out and talk about it and help train people. But so I'll help them however, we'll help them however they need or want. Maybe they don't need to be involved at all. But in my last job, I actually did work in the IRIS system, so I have both sides of it. In McHenry County, we're the 6th biggest county in Illinois, and we don't have this system that connects agencies together. And then work to increase services for children within the early childhood education and care classrooms who require that extra support due to developmental delays and or challenging behaviors. So The teachers in a childcare, they're absolutely educated. You can't work alone with children if you don't have at least some college education. And they are not, however, trained like the public school special needs teachers. And the ratios are extremely high. And they can't lower them because they're already barely able to pay their teachers and all the bills. So they can't say, well, you have a child with, special needs. So instead of having the ratio be 1 to 10 for 3 to 5 year olds, we'll have 2 teachers in there, so it's 1 to 5. They can't do that. So these teachers, not only are they obviously frustrated with the large grouping and the behavior challenges or kids who have some kind of delay, but they're also feeling that they're not even adequate for this job, which isn't right because they are. It's just they're not properly trained. So right now we are having, I'm having individual meetings with childcare programs. I've already met with 25 childcare centers this month alone. And we're giving them a survey that our councils developed to see exactly what kind of support they think they need. Instead of us saying, okay, this is how we're gonna help you. So we're trying to figure out what they need so then we can figure out how we can bring that support to them. Then, all 39 of our early childhood regional needs assessments touched on mental and behavioral health. So the state did have us do another needs assessment based just on mental and behavioral health. And what we found is in our county of Region 44 in McHenry County, only 1 center teaches the pyramid model. And the pyramid model, it's a national program that promotes social, emotional development and teaches relationship skills, which is huge for mental behavioral health for those littles under the age of 5. There are 308 home visiting slots for 17,824 children under 5. We only have 1 infant early childhood mental health consultant to work with all the child care centers and homes in our county. 61% of people surveyed across Illinois have said they waited 2 or more months to gain services after receiving a referral. And most mental health providers offer services in Crystal Lake, McHenry area. There's none out in the rural areas. We have been also advocating for more mental and behavioral health for the little children. I mean, I just spoke up at the town hall, at the mental health board. We're currently now talking with anybody who provides mental behavioral health services in our county to see, even if they don't specify that they work with those children, do they work with the families or the parents, and could the parents or caregivers bring that child in if that's their struggle? Because some of these mental behavioral health professionals are saying, the parents are coming in and saying, I'm really struggling with my 3-year-old who hits me all the time. So they will have the child come in and do play therapy with them, with the parent, to teach them. So we are trying to figure out, and we'll make a list to put on actually a resource website that one of our Action Council members started up called Northern Illinois Parents. So we're gonna have a list on there of what mental and behavioral health professionals say that they do actually work with the children with the parent or caregiver present. Some of the things that we heard when we did that needs assessment is that it's a lot of legwork you have to do to even figure out a place you could get them into. There's no real good system. Teachers, we also talked to teachers about their mental health. Teachers need to be fueled to take care of their students. With home visiting, it was very easy for my child to transition from early intervention to preschool, which in turn made it easier to transition for me. And then the town that has the largest Spanish-speaking population has no mental behavioral health providers, let alone ones that speak Spanish. So these are things that we heard when we, again, talked to the community.
That's a question.
Sure.
Home visiting, can you clarify that?
Yeah, what it is.
Yeah.
So home visiting is when a home visiting professional can go to a home and work with a parent, almost teaching parenting skills. And it doesn't matter if, you know, maybe you're a young parent and you're just like, I don't know how to do this. I wasn't planning, you know, pregnancy. Maybe you're, you know, a professional and you are more on the higher end of making money, but again, you just want that help to make sure that you're doing everything right. These professionals come in and work with the families. I don't know, Chris, if you want to touch any more, because I know you used to.
Yeah, and they also do developmental screenings on the children to see if they're hitting their milestones, and if they're not, then they refer them to early intervention or to the appropriate places for therapies. They do like activities with the kids, so it's like a little bit of a learning, hands-on session with the children, and then they also teach the parents how to do those activities with the kids too.
And aren't there some requirements
Yes.
in the courts themselves that require?
Yeah, I was gonna say some families are required, like, you know, if DCFS is involved,
Yeah.
it might be part of that they are required to go through home visiting or have those home visiting services, yeah. Yep. So again, we came up with some recommendations that we've been working on, creating a virtual or in-person resource hub to link those parents and caregivers to the mental and behavioral health services. Again, we do have that Action Council member who has Northern Illinois parents. We are currently, like I said, surveying the mental and behavioral health specialists so that we can update a list on there. Offering groups to support the mental health of caregivers and families, especially for new parents, grandparents raising grandchildren, children of divorce. So again, we've been out advocating for this. There actually is a group out there now between Options and Advocacy and New Beginnings that does one for new parents. I am actually going to be talking with Brenda from The Break. She said that she and another woman are starting up a support group for grandparents raising grandchildren because McHenry County does have a high number of this. So, and this is actually raising them. This isn't, you know, like Eric said, this isn't watching the child while the parent works. This is actually raising them. And unfortunately, a lot of it is because of opioids. So the parent either unexpectedly goes to jail or passes away. And then the grandkids pretty much just show up at the doorstep and they hope the grandparents will help take them in. So when I reached out, when I heard Brenda was starting this, I reached out and said, is this just for ones that are raising teens, since that's mainly what she works for, or works with that population? And she said, no, she's open to anybody. And then she said she wanted to get together. So we'll be working more on that. And then more training and educational opportunities for parents and caregivers by mental and behavioral health professionals so that they can better understand where to find these developmental evaluations, behavior assessments, services, and supports. We did just hold a community meeting that will be posted on our website because we recorded it, and we had 6 guest speakers talk about the mental and behavioral health that they give in the county. So we had like NAMI on there, what?
Excuse me, HLC therapy,
Yeah, there we
NAMI, Love for Family Therapy, home Beyond Play, which is also home visiting, early intervention program. I can't think of the other two right now. Neuro-inclusive counseling.
Northern Inclusive Counseling, yeah. Oh, and then Pioneer Center, there we go. And then we also did create a pamphlet for parents that talks about different services in our community that serves early childhood education and care. And we're putting those all over where parents might get resources like churches, libraries, We want to get in doctors' offices to have them there, but it does talk about early intervention and home visiting, the Child Care Resource and Referral Agency, Head Start, some school readiness goals. So we did create that. And then here's some highlights of our ongoing work that we do. We hold our monthly council meetings, so Action and Family Council meetings are held separately once a month. We host community meetings. We have a bi-monthly newsletter. Again, I have those meetings with elected officials that cover the state and locally. And then we go to events and have tables at different kind of family events, and then also attend those networking events to talk to people that are kind of outside the early childhood education and care realm, to let them know also just how important this work really is. And then there's information about staying updated with us.
We have a lot of information on our Facebook group too. So if you decide to follow that, you'll find out where we are at in the community and some of the events that we've been attending, and some updates with the state of Illinois, the early childhood, the new department that's being formed.
Yep.
So all kinds of stuff.
So is this a state-funded program?
We are funded by the Illinois State Board of Education. We're grant funded.
You know what, for me, I'll two comments. One, it would be really interesting to me to see how McHenry County compares to the other Collar counties.
Oh, it's all in a statewide report.
Okay, so that would be nice for somebody to forward to us, or maybe forward it to Tracy or Kathy, and we get, because I'd be real curious to see how we compare to that. And then the other comment I will make to you is, when you talk to our elected officials and when you talk to those people in the newly formed early childhood, they're gonna have to be extraordinarily creative, and I'm giving you my mother, I'm talking to you like a mother, and you can add whatever you want to that. They're gonna have to be very creative, because funding is always gonna be an issue. We don't use our retired, trained teachers very well at all. So my comment is they need to get out of this mindset that you can only have this. They're gonna have to think about expanding and who we really can tap into as a resource to assist us actually staff many of the places that we can't, because we don't have those professionals. So you can tell them that from a local elected official, they need, and as a former school teacher, they need to start to think a little more creatively to try and fill these positions with people who are trained, who, like you heard, Carolyn Lawson, who is retired and dying to do something to help her community.
Right.
You know, so they need to look at that, and I'm not saying reduce, I'm saying be creative in how you can grab those people and use them appropriately to provide the services that we so desperately need. And I'm assuming, again, the idea is you spend the money early and we're not spending it later, right?
Exactly.
Is that's the whole point? Okay.
That's the entire point,
Tailoring it to the communities. Right. Because it's very different here compared to Southern Illinois or whatever.
Exactly.
And Region 44 is just McHenry County? Okay.
It's with the Regional Office of Education, right?
Correct.
That's how it's so.
Yeah, that's how we're set up, yeah.
So just to clarify funding, are you a state agency or a nonprofit funded by the state?
Yes, we're nonprofit grant funded.
Okay, so did the organization start prior to the grant funding, or?
Our very first year, we were funded by the Department of Human Services, and then it went to ISB.
Okay, but it's always been a nonprofit? It's
Yes,
always been
correct, yeah.
Agency, okay.
And I'm assuming that you'll probably end up in early childhood, right? You won't, probably, maybe.
Oh, yes,
Yeah, I
yeah,
mean,
because we're under, we're a department under INCRA, the Illinois Network of Child Care Resource and Referral Agencies, so wherever they end up, we are under them.
Yeah.
Yeah, and obviously they're huge, they're in Bloomington, they cover the entire state, they're huge. Yes, yeah.
Thank you.
Yeah, and then, yeah,
Thank you
and
for
there's
coming.
my,
Yeah, really, thank you.
information.
And if you have any events where you want us to be at,
You guys do people in need too, don't
do.
you? Yeah, I thought I saw you there, yeah,
That's
yeah,
really
I
good
thought,
to know.
yeah.
Yeah, we're all over.
We're all over.
Okay, that's good to know for events too.
Yeah.
That you're available to come because there really is a need, I know that. So the presentation that you just did, are we able to see that if we go to your website?
No,
Not this presentation, the community meeting will be posted on
Yeah.
our website soon.
Okay, all
but
right.
this presentation was given, I emailed it over.
Oh, you
Yeah.
did email it over?
Yeah.
Okay, so we have it. Okay.
Do we have any other questions? Thank you so much for coming in.
Oh, yeah.
Thank you.
For having us. Keep people informed.
Thank you.
Do we have any reports, Pete?
We'll have some budgets next time.
Okay.
How many? Just for timing, just you know this, so you know, because it's timing, and I think that
Yeah.
that's important to us. Do you have any idea?
I don't even know how many come to this committee up.
Okay, I was thinking you mean.
Health, community development. They'll be great.
And I'll look at all of you jumping in as I do, because I started it in law and government. You know, we've had comments at the board meetings and at our committee of the whole meetings about, you know, too much information and not having time and blah, blah, blah. This is it, right? This is when we're looking at the budgets. This is when we should be digging down deep and finding if there's anything that we as policymakers can reduce, can modify, can do whatever, and make those recommendations to staff and not make staff make those recommendations to us. We're the policymakers. So we had 6 people make a reduction request. We had many people saying no growth or little growth. This is where we do that work, right here at these committees. So I've been beating Peter up left and right, and I'll take the grief. That means that we're gonna have to spend some time. So don't, you know, budget, poor Patty got this twice in this week. Budget your time appropriately, because this is where we have those conversations, right? Instead of just listening and going, yeah, we'll forward it as it is. We need to give them direction. So.
How far in advance are we able to get what they're going to be presenting?
Well, if the request is earlier, we can work on that. You know, the normal process is your budget, your agendas are posted on Mondays
Yeah.
for Thursdays.
Yeah.
Which isn't a lot of time. To Tracy's point, it's not.
It's not.
If your direction as chair is that you'd like to see that sooner, we can accomplish that. I'm not gonna commit to which budgets will come next time. We'll have the Regional Office of Education, Community Development, Health Department. Health Department's a big one, you know. You've got a complicated mix of grant-funded positions
Yeah.
And if-
ARPA-funded positions.
And if you followed what we did at Law and Government, you're gonna get what's mandated, what's not mandated. I mean, they've broken it down pretty detailed, from a detailed perspective, but they've also indicated which ones are grant positions, which, you know, so it's a lot of information, and I thought it was excellent presentation, or at least what we got anyway, so I get it. I just, again, want people to understand.
Just the preview, and as we
Yeah.
talked earlier, this committee, with Pam's committee, I mean, if we reduced the levy last year, and we're starting from a smaller spot, and if we take the allowable 2.9% and the new growth, we're still $1 million short. So it's going to be a challenge when we look at, you know, what we're not going to do, if that's the path we're going to go down. If we stay flat, we're $3.7 million short. If we go down by 3%, we're $5.7 million short. You know, $5.7 million is $5,700,000 positions. So
And don't forget
you can't cut your way out. We can't cut your way out. It takes lots of levers and changes in levies and delivering services completely differently or not delivering them
And
at all.
then next year, don't say you can put it off, because next year, that number's lower. Again, you have less to grab from, so just.
Pete, is there a way when we look at this, and I'm just asking, When we say there's a grant-funded service program, and then are we able to see, okay, has that program service provided, okay, if we lose money, sustainability, a logistic model, et cetera, to see, does this service completely go away? Do we get some of the service? We get a fourth of the service? We get a piece of glitter of the service? Is there a way to see that?
Yes,
Oh.
it's not a neat, simple presentation, because as you can imagine, when you have half a position funded by a grant, 1 year and 40% the next year, or, it's always changing situation. But
How we
those are really
manage.
good questions,
How we
and
manage money.
let's commit to having Melissa here next time around, kind of pushing on those things.
Yeah, I mean, I think like for me, I would like to know the grid of it versus like this or that, right?
Mhm.
So I think it's important, and depending on the service you're speaking on, that's also important.
Mhm.
So that would be helpful, if possible.
Challenge accepted.
Great.
Yeah, I'm here for the challenge.
I do think, though, that I think many of us would appreciate a longer time to be able to look at the information before the discussion.
You gotta remind me. It's Wednesday, we gotta get that out.
And you don't necessarily have to send the whole agenda, I mean, if it
Right,
doesn't,
right,
just
right.
send us the
Like,
budget.
obviously
Just the-
set.
Yeah.
Yes.
I'll take what you
Yes.
got, and then we could do it in increments as you get them versus 70,000 pages, right? I take.
Yeah, that's what I'm referring to
Yesterday,
as more
Carrie
time.
scheduled a zillion budget meetings for the month of July. So I gotta look and see where they're falling, just to know what would be here in 4 weeks.
Okay, motion to adjourn.
Oh, wait, hold on, first, new topic.
Oh, I'm sorry.
I don't care if it's next meeting, either next month or the month after, but I think it's worthy of discussion regarding the Board of Health terms structure.
Let us follow the process. Let the Board of Health should make a recommendation to this committee, and this committee should then, we'll.
That's fine.
Yeah,
But as long, I just don't want it to fall off the way.
But thank you for
Yeah.
giving us direction
Right.
for the liaison to take it to the Board of Health and talk about it.
Yeah, sure, that's what.
Perfect.
yeah.
Good job, Dan.
Perfect, okay.
Got it.
Ms. Altough, motion
All
to
right.
adjourn, Mr. Hendricks,
I don't even
seconds,
know if
all
my
those in favor?
staff is there, but-
Aye.
And
That's
motion
why I
carries,
wanted
thank
to
you
do it
very much,
there.
everybody.
So thank you.